Every single month, if you're on Medicare, the federal government takes $185 directly out of your Social Security check before you ever see it. It's called the Medicare Part B premium, and for most seniors, it feels like an unavoidable fixed cost of being on Medicare. It is not unavoidable for everyone. There is a federally funded program, actually 4 versions of a program, that pays your Medicare Part B premium for you, completely, down to zero, every single month for as long as you qualify. And the income limits to qualify are higher than most people assume. Many seniors who think they make too much to qualify for assistance are actually well within the limits. They've just never checked. Today I'm walking through exactly what this program is, all 4 versions of it, the real income numbers, and exactly how to apply. My name is Lucian Vane. I've spent years studying the assistance programs layered into Medicare and Medicaid, and Medicare Savings Programs are, without question, one of the most underused benefits available to American seniors. The data backs this up. Multiple studies on Medicare Savings Program enrollment have found that a significant share of eligible seniors, by some estimates more than a third, never apply, simply because they don't know the programs exist or assume their income disqualifies them. Let's fix that today. Before I walk through the 4 specific programs, let me explain what a Medicare Savings Program is at a basic level, because the structure matters for understanding why it's worth so much money. A Medicare Savings Program, often abbreviated MSP, is a state-administered program, funded jointly by federal and state money, that helps people with limited income and resources pay for some or all of their Medicare costs. Depending on which version of the program you qualify for, it can cover your Part B premium, your Part A premium if you have one, your annual deductibles, and your coinsurance and copays for Medicare-covered services. Here's why this is such a big deal financially. The Part B premium alone is $185 a month for most people in 2025. That's $2,220 a year. But the full Medicare Savings Program benefit for those who qualify for the most comprehensive version can also eliminate copays and coinsurance, which for someone with ongoing medical needs can be worth thousands more per year. Here is the most important thing to understand before we go through the 4 programs. This is not Medicaid in the traditional sense, even though it's administered through your state's Medicaid office. You apply through Medicaid, but you do not need to meet full Medicaid eligibility. The income and asset limits for Medicare savings programs are specifically designed to be more accessible than full Medicaid. This is the single biggest misconception that keeps eligible seniors from applying. They hear apply through Medicaid and assume they need to qualify for full Medicaid, and they don't even try. That's a mistake worth correcting today. Program number 1, and the most comprehensive of the 4, is called the Qualified Medicare Beneficiary Program, or QMB. This is the version of the Medicare Savings Program that covers everything. Your Part B premium, your Part A premium if applicable, your annual deductibles, and your coinsurance and copays for all Medicare-covered services. Let me be very specific about what QMB means in practice because this is the program with the biggest financial impact. If you're enrolled in QMB, Medicare providers are legally prohibited from billing you for anything beyond what QMB covers. This means no Part B premium deduction from your Social Security check, no deductible when you see a doctor, no 20% coinsurance that Medicare normally requires you to pay. Your doctor visits, hospital stays, and other Medicare-covered services become essentially free. This is such an important protection that I want to repeat it clearly. If you are enrolled in QMB, it is illegal for any Medicare provider, doctor, hospital, specialist, to bill you for the difference between what they charge and what Medicare and QMB cover. This is federal law. If a provider bills you anyway, that's a billing violation you can report. Now let's talk about who qualifies, because the income limits are higher than most people assume. For 2025, a single person can qualify for QMB with a monthly income up to approximately $1,325, about $15,900 a year. A married couple can qualify with a combined monthly income up to approximately $1,783, about $21,400 a year. I want to pause here because this is the number that surprises people. If your only income is Social Security and your monthly benefit is below those thresholds, which describes a very large number of seniors, you very likely qualify for QMB full stop, not a reduced premium, zero deductibles, zero coinsurance. Here is a real example. A retired widow living on Social Security alone receives $1,280 a month. She has been paying the full $185 Part B premium out of that check for years, not realizing that her income is below the QMB threshold. If she applies and is approved, she would save $2,220 a year in premiums alone, plus eliminate any deductibles and coinsurance she's been paying for doctor visits. Program number 2 is called the Specified Low-Income Medicare Beneficiary Program, SLMB, pronounced SLIMB by most people who work with it. SLMB is for people whose income is slightly above the QMB threshold, too high for QMB, but still low enough to qualify for help with the Part B premium specifically. SLMB covers your Medicare Part B premium completely, that $185 a month, but unlike QMB, it does not cover deductibles or coinsurance. Still, eliminating the Part B premium alone is over $2,200 a year back in your pocket. For 2025, the SLMB income limit is approximately $1,585 a month for a single person, about $19,000 a year, and approximately $2,135 a month for a married couple, about $25,600 a year. This is the program that catches the most people who assume they make too much for assistance. A retired couple with a combined Social Security income of $23,000 a year and a small pension might assume they're well above any assistance threshold, but $23,000 a year is still under the SLMB limit of roughly $25,600 for a married couple. One important detail about SLMB: you can actually apply retroactively for up to 3 months before your application date if you would have qualified during that period. This means if you've been paying the Part B premium and you just found out about SLMB, you may be able to recover up to 3 months of premiums you already paid. Program number 3 is called the Qualifying Individual Program, QI, and it's for people with incomes slightly above the SLMB limit. Like SLMB, QI covers your Medicare Part B premium completely, but it has a higher income threshold, which means it captures more people in the moderate income range who might assume there's no help available to them at all. For 2025, the QI income limit is approximately $1,781 a month for a single person, about $21,400 a year, and approximately $2,400 a month for a married couple, about $28,800 a year. Here is the detail that makes QI different from the other 3 programs, and it's important. QI is funded through a limited annual federal allocation. That means it operates on a first-come, first-served basis each year, and you must reapply annually. If you wait until later in the year to apply, funding for that year may have already been exhausted in your state. This is the one program on this list where timing genuinely matters beyond just apply when you find out about it. If your income falls in the QI range, apply as early in the calendar year as possible and mark your calendar to reapply at the start of every subsequent year. Program number 4 is more specific than the others and applies to a smaller group, but for that group, it can be extremely valuable. It's called the Qualified Disabled and Working Individuals Program, QDWI. QDWI is specifically for people under 65 who have a disability, who originally qualified for premium-free Medicare Part A, but who lost that premium-free status because they returned to work and their earnings increased beyond the limit. For these individuals, QDWI pays the Medicare Part A premium, which can be substantial, several $100s a month for people who don't have enough work credits to receive Part A for free. The income limits for QDWI are notably higher than the other 3 programs, approximately $5,302 a month for a single person and $7,135 a month for a married couple in 2025, because this program is specifically designed for people who are working and therefore have higher income, but who still need help with the Part A premium specifically. If this describes your situation, you're under 65, have a qualifying disability, returned to work, and lost premium-free Part A, this program is worth checking immediately because Part A premiums for people without enough work credits can be several $100s a month. Now I need to address the part of these programs that scares people away the most, even when their income clearly qualifies. It's the asset limit. Every Medicare Savings Program also has a limit on the value of your countable assets, savings, investments, and similar resources. And many seniors assume that having a paid-off home or a modest retirement account automatically disqualifies them. It usually does not, and this is critical to understand correctly. Here are the 2025 asset limits for QMB, SLMB, and QI, approximately $9,660 for a single person and approximately $14,470 for a married couple. Now here is the part that surprises almost everyone. What does not count toward that limit? Your primary home does not count regardless of its value, even if it's worth $500,000 and completely paid off. One vehicle does not count. Personal belongings and household goods do not count. Burial plots and a modest amount set aside for burial expenses, typically up to $1,500, do not count. Life insurance policies with a face value under $1,500 do not count. What does count toward the asset limit? Money in checking and savings accounts, stocks, bonds, mutual funds, and additional vehicles beyond the one excluded. Most traditional retirement accounts like 401ks and IRAs are typically not counted while you're still accumulating them, but may be counted differently once you're taking distributions. This varies by state, so it's worth confirming specifically with your state Medicaid office. The takeaway here is simple. Do not assume you're disqualified because you own a home or have modest savings. Apply and let the actual calculation determine your eligibility. Here is a piece of this puzzle that almost nobody explains, and it can mean an entirely separate category of savings on top of everything we've covered so far. If you qualify for any of the three main Medicare savings programs, QMB, SLMB, or QI, you are automatically enrolled in the Extra Help program, also called the Low-Income Subsidy for your Medicare Part D prescription drug coverage. This means you don't need to fill out a separate application for prescription drug assistance. The moment your Medicare Savings Program application is approved, the Social Security Administration is notified, and you are automatically enrolled in Extra Help, which can reduce your prescription drug premiums, deductibles, and copays dramatically, often to just a few dollars per prescription. For someone taking multiple medications regularly, this combination, a $0 Part B premium plus dramatically reduced prescription costs, can be worth $4,000 to $6,000 a year or more, depending on their medication needs. One application, two major federal benefits, and most seniors have never heard that the two are connected. Here is exactly how to apply, step by step. Step 1. Contact your state Medicaid office. Medicare savings programs are administered by Medicaid even though they help with Medicare costs. Search your state name, Medicaid Medicare Savings Program application, to find your state's specific process. Step 2. Gather your documentation before you apply. You will need proof of income, your most recent Social Security award letter or pay stubs, and proof of assets, such as recent bank statements. Step 3. Complete the application. Most states allow you to apply online, by mail, by phone, or in person, at your local Medicaid or Department of Social Services office. The application typically asks about your income, your assets, and your household size. Step 4. If you're not sure which of the 4 programs you qualify for, don't worry about choosing the right one yourself. The application process determines which program you're eligible for based on your actual income and assets. You don't need to identify QMB versus SLMB versus QI on your own. Step 5. If you need help filling out the application, call your local area agency on aging at 1-800-677-1116 or contact your state health insurance assistance program, called SHIP, which provides free, unbiased Medicare counseling in every state. SHIP counselors can walk you through the entire application at no cost. If your application is denied, do not assume that's the final answer. Denials happen for reasons that are often fixable. The most common reason for denial is incomplete documentation, missing a bank statement, an outdated income figure, or a form filled out incorrectly. If you're denied, request the specific reason in writing. The second most common reason is a miscalculation of countable assets. For example, a caseworker incorrectly counting a vehicle or burial fund that should have been excluded. If you believe your assets were miscounted, you have the right to appeal. Every state has an appeals process, and the deadline to file is usually between 30 and 60 days from the denial notice. Your local area agency on aging or SHIP counselor can help you file the appeal at no cost. Here is your complete action list. 1. Calculate your total monthly household income, including Social Security, pensions, and any other regular income. 2. Compare that number to the thresholds we covered today. Single, roughly $1,325 for QMB, $1,585 for SLMB, $1,781 for QI, married, roughly $1,783, $2,135, and $2,400. 3. Remember that your home and one vehicle do not count against the asset limit. Don't disqualify yourself before you even apply. 4. Search your state name, Medicare Savings Program application, to find your specific state process. 5. Gather your Social Security award letter and recent bank statements before you start the application. 6. If you need help, call 1-800-677-1116 for free, unbiased assistance from your area agency on aging or a SHIP counselor. That $185 a month coming out of your Social Security check every single month is not necessarily a fixed cost. For millions of seniors, it's a bill that a federal program already exists to pay. Completely. The only thing standing between you and that $0 premium is one application most people never file. If this video helped you, subscribe. Every week I cover the Medicare, Medicaid, and Social Security programs most seniors never hear about until years after they could have used them. Share this with anyone you know living on a fixed income who has never checked whether they qualify for a Medicare Savings Program. This single program could be worth thousands of dollars to them this year alone. I'll see you in the next one.